Good morning and welcome. Welcome to the Retired Living True series, and today's topic, the truth about brain disease. My name's Brett Janelle, and this is my beautiful wife and business partner, Annette Janelle. And we're the founders of the True series. We started this about 7.5 years ago. I think the very first one we did had like 10 people, and it's grown since. Who was with us like 7 years ago? Anyone? Yeah. Quite a number, so here we are today. So I commend you all for coming today.
The speaker is not working.
Oh, thank you for letting us know that.
Do we have the above speakers? These speakers are turned off. We had problems. The above speakers are working, yeah. So no sound is coming out of these speakers.
Can you hear me very well? You can hear me, so maybe you should use my mic instead of that one. Do you think that would be better?
Can everyone hear me on this side? Can people hear me on this side, or nothing's coming out of the speakers? No? Thumbs down? We have a sound issue on this side of the room for some reason. Thanks, Jeff. So we'll work on it. Let me turn... Actually...
Doing acrobatics. I do not dare jump off this stage.
Let's see how I do jumping up.
Okay.
There we go. Can you hear me now on this side? Excellent. Okay, so we'll just use this for the moment. Where were we? I think I was talking about my beautiful wife who's like, yeah. So I just wanted to commend you all for coming along today, because this is a really tough topic. We all want to maintain our independence. We all want to keep making decisions. But unfortunately, brain disease is a growing problem, or at least a more identified problem. And some of us are definitely going to be affected by it. And I'm just curious, just by a show of hands, who has a family member or a friend who has, or in the past, had some form of brain disease? Wow, look at all the hands, pretty much the whole room. Yeah, so it affects a lot of people. And you'll hear from our panelists some statistics in terms of how many people are affected with different types of brain disease, and some of the things that we can do to perhaps prevent or slow down, and we'll talk more about it as we go along.
Yeah, Brett and I have definitely seen it in our own business with people that we've helped to downsize, and whether you're a caregiver for a partner or if it's the people themselves and the family members that come in and help. So through that process, this is why we brought this to the seminar series, so that we can talk about it, and obviously it affects so many people in our community.
So with that said, let's hear from our expert panelists. So Nikki, Mindy and John, could you come up and join us, please? So I think I'll take a seat.
Okay.
We'll turn on our microphones. And I'm going to start with you, Nikki, for an introduction. And yeah, Nikki, if you could just go ahead and introduce who you are, what organisation you belong to, and why you're here for this topic today.
Good morning, everyone. It's great to see you all. My name is Nikki Rubath. I'm the Regional Director with the Alzheimer's Association here in Northern Nevada, and I oversee all of our programs for caregivers, for people who are living with any form of dementia, and I'm responsible for raising the money to fund those programs as well.
Hello, everybody, and good morning. I am Dr. Mindy Lakshan. I am the founding chair of the Parkinson Support Center of Northern Nevada. We are a fairly new organization, just 3 years old, and we offer support programs, educational programming, and advocacy for people with Parkinson's disease.
Thank you. Dr. Rob?
Hi, my name is John Arts. So I've been at Renown Health for 3 years. I'm actually have two positions. I work at neuro-science medicine. I direct the neurology clerkship. That's for the 3rd and 4th year medical students. I also direct the course for the 2nd year students on the brain and human behavior. And I was pretty much brought to this area. I was in Marin County for almost 20 years doing adult neurology, and to take over for the cognitive memory, I call it the brain health. I feel I'm a brain health neurologist, but the reality is I'm an adult neurologist, board certified, and I'm here to help you understand the brain, and hope you'll get a lot more information at the end of this talk. Thanks.
Thank you. I'm kind of a little intimidated with these three panelists beside me. Do they help me with the questions to ask them? So maybe if I could start with you, Dr. Lakshan. Could you just tell us a little bit about what is brain disease?
Brain disease is like any disease. It's a misfunction or a lack of proper function of a particular body part. In this case, it's the brain. So whether that be related to a neurodegenerative disorder like Parkinson's, Alzheimer's, multiple sclerosis, or whether that be head injury, there's lots of different things that cause the brain to not function well. And a brain disease is when the brain is not functioning well.
Thank you. Dr. Arts, what would you like to add to that?
Yeah, so I like to think of brain disease as a spectrum of problem, but in the community, the most common causes of a brain condition, that means that the brain is your memory, your thinking, your reasoning, your problem solving. We use the word cognition, and cognition and memory is included in that, is affected by many issues. The most common actually being cerebrovascular disease, having a stroke, too much drinking. Actually, anxiety and depression can cause cognitive problems because if you can't focus and you're worried and you can't concentrate, that leads to problems with retention of information. And then everybody's heard of Alzheimer's disease. That's probably why I see at least 75% of my patients that are referred to me because they have a concern of that issue, or they may actually have a family member who has that issue. But it's a spectrum disorder, and hopefully you understand that by the end of this talk, that people have different levels of impairment from normal aging. I'll give you some books at the end. We'll talk about that you can read that are by some very well-known authors in this space, so you can recognize that some issues that you may have actually may be normal for you, and then there's some issues that are red flags that you may need some attention from a provider of care. Thanks.
Thank you. Is my microphone working? No? Is it working on that side? Okay. Go back to this one.
Thank you. Mindy, can I ask, is it easy to diagnose the different types of potential brain diseases?
Short answer, no.
No. A little longer, 20-second answer.
20-second answer. Short answer is no, because it's not like a broken toe that you can just look at, it's swollen, take the x-ray, and you see where the fracture is. There are some radiologic studies that can be done to look at the brain, CT scan, MRI, PET scans. There's some other specialized ones for Parkinson's. They're not necessarily perfect. There's also some neuropsychological testing that can be done that I'm sure Dr. Arts can talk to a greater extent, where people ask you, if your primary physician would ask you to spell the word world backwards or count down by sevens. I'm sure everyone's had to do that at some point. Just a basic screening test for some cognitive issues. And then there's extensive testing that can be done by specialists, 4 to 6 hours of questions and testing that can be done to evaluate the brain function. But it is not an easy diagnosis, and many people with Parkinson's, with Alzheimer's, they can have symptoms for many, many years before they actually reach a diagnosis.
Thank you, and we'll come back and talk about diagnosis a little later. Nikki, if I could start with you, could you just share with the audience what are the most prevalent types of brain disease we see here in our community? We'll just go down the panel.
Yeah, that's a great question. Well, most often, as Dr. Arts already mentioned, we do see Alzheimer's disease. About 70% of cases of dementia being the overall umbrella term, right, are Alzheimer's disease. But there are many others. There are Lewy body dementia, frontotemporal dementia, the kind of dementia that's caused by cardiovascular disease, by alcohol use. So there are many different forms. And in some ways, what's important is that if you see any symptoms in yourself or a loved one, you have that conversation with your healthcare provider. Recognizing those symptoms and talking about them is the most important thing that you can do.
Thank you. Mindy?
I agree completely that cerebrovascular disease is probably number one. So you think strokes, and strokes may not be, you suddenly have a left-sided weakness, for example. It can be some memory impairment alone as the only symptom, or some difficulty finding words as the only symptom. So cerebrovascular disease, number one, if there's any question about yourself or your loved one having difficulties processing two directions, go down this hall and then turn left and then turn right. Can you follow that? Can you find the words you need to describe what's going on with your day? Do you remember what you had for breakfast yesterday? Things like that is not, it can be a cerebrovascular issue.
Dr. Arts, what would you like to add? And can you also talk a little bit about us being self-aware of perhaps cognitive issues? Are we able to self-realise something's going on, or is it really, as was mentioned, family members and friends?
Yeah, so this will be reiterated at least several more times, but if you have a family member or yourself that have an issue with thinking or memory, and I will recommend some books that you can read to identify whether the concerns you have are actually something that you definitely should be concerned about, because there are some issues like going into a room once a week and forgetting what you put down and then recognizing what you did after a few minutes. That's considered usually normal. It depends on how often these things happen. Are they progressing over time? Are they becoming daily? So there's things that I use, tools that are historical. And the important thing about the history of this type of issue when memory and thinking are involved is oftentimes a patient may not be aware of the extent of their problem. I would say at least 50%, if not more, patients that come to see me don't recognize the magnitude of the problem. And my pet peeve is that the patients often don't bring somebody with them. And it's super duper important to get more information from I call it the observant or an informant because that person often knows and recognizes and has recognized for months, if not years, changes in potentially you or a family member. So again, I think it's a two-way street. It's the street. It's the information that the person's giving to the physician. It's also actually as important or more important, the information that your I call it informant, your liaison, your friend, your close family member when you come to the visit, you should bring somebody. That is super important. Now I want to say one last thing about this. Cognition and memory, there are a lot of people that don't realize they have a problem. And what's really interesting about Alzheimer's disease, a lot of patients don't. If I ask the patient, and in retrospect, when I feel that that's what they have, and talk about testing that can be done to kind of make that more of a more specific diagnosis, but many patients will say to me, and if I ask them, do you have a memory problem? They'll say, I don't know, I'm here, I think I'm fine, right? And these are people that have had problems for 2 years. And if you ask the family member what's going on, they'll say, yes, 2 years ago there was forgetfulness, and it started to happen a couple times a week, and then it became a few times a day, and then it was frequent, and the patient loses insight. One of the reasons that happens is the frontal lobes of the brain, which is the area that makes people human, the prefrontal cortex, and this part is important in kind of your interpretation of what's happening to you. And that can eventually start to go. So this lack of insight is pretty common in neurodegenerative disease, Alzheimer's being the most common condition.
Thank you. Just one other thing I wanted to touch on when we were talking earlier this week was depression, anxiety. Is that brain disease or is that something else?
Yeah, so I'll say a couple things. So, and you can comment about this. So anybody that develops midlife anxiety or depression can be a red flag actually for a neurodegenerative disease, especially if it comes out of the blue. Sometimes it's hard to tell, did it come out of the blue? But there are some problems when the brain tissue isn't working and you lose neurotransmitters, which you may have heard of serotonin, which is important in mood. You may have heard of dopamine, which is a movement-related neurotransmitter. We can treat people with Parkinson's with dopamine drugs. You may have heard of Sinemet, carbidopa, levodopa. But eventually, there can be issues with anxiety and depression as a manifestation, the earliest manifestation of a potential problem when the brain tissue isn't working. So there's this historically psychology and psychiatry and neurology. They used to kind of be separated out, but we know that if you have a damaged brain like a head injury or a stroke, people have depression and anxiety as a manifestation of that. Some people do after their brain tissue has been impaired. There are other people that have this, just out of the blue, of getting moody, I'm getting anxious, I'm getting nervous, I'm being irritable. That starts to progress, and there's no obvious other symptoms, and that can be an early manifestation that the underlying nerve tissue is not functioning correctly. So, again, mood issues can, to answer Brett's question, definitely can be an underlying marker for the brain tissue not working, but it also can be a manifestation of the brain that has already been impaired, and it's a result of the brain tissue, sort of the chicken and the egg situation.
No, thank you.
Yeah.
We're going to talk a lot more about that in June, the truth about mental health, because depression is something that affects a lot of people in the community, which I wasn't quite aware of. So we're going to talk about it in more detail. Mindy, could we talk a little bit about what are some of the misconceptions or myths around brain disease?
Definitely. There are a lot of cultural differences in reflecting on brain diseases and difficulty with thinking and processing information. And I know that in quite a few cultures, if somebody is forgetful, isn't moving properly, some people will say, oh, that's because you had an evil eye put on you, right? I'm not joking. It's serious. There's a lot of misconceptions as to why people have problems. Is it something they did? Is it all their fault? Are they guilty? If they're feeling guilty for their disease, they're not going to admit that they have problems. They're not going to admit to family members, gosh, it took me 2 hours to find my car keys yesterday, but I'm not going to tell anybody that because they're going to say, oh, you did something wrong. You must have been drinking. You must be doing something else. So there's guilt that makes people not admit to their problems. There's cultural biases. This is not something we admit. I know certainly in the Hispanic community, it's a major problem. There's actually a higher rate of Parkinson's for some Hispanic populations because there's a lot of field workers who are working around pesticides. And the pesticides are directly related to several brain disorders as well as cancers and everything else. And it is not okay within that culture to say, Grandpa, you're not walking right. Grandpa, you're not speaking right. Grandma, why are you crying all the time? Things that are signs or symptoms of severe brain disorders are not being recognized because of cultural biases and guilt.
Thank you. I'm just curious, how many people in our community are affected by Parkinson's? Actually, before you answer that, just show of hands. Who knows someone dealing with Parkinson's at the moment? Wow, a lot. So just any statistics you might have on that?
The statistics are not very accurate, shall we say. Officially, there are 10,000 people in the state of Nevada. Most neurologists, and Dr. Ars might agree or not, that for every one person diagnosed, there's probably at least 3 to 4 people who are not diagnosed. And there are a lot of people, because we are I hate to use this phrase, but a neurology desert. There aren't enough neurologists here. Thank you, Dr. Ars, for being here. But there aren't enough. And a lot of people may go to California to get their neurology care, and will those records then come back and be in Nevada saying, this is a way of identifying how many people are here. All that being said, we guesstimate it's at least 1% of the population has Parkinson's, at least, by most studies, which means that we should have at least 5,000 people in northern Nevada with Parkinson's.
Thank you.
I would like to also bring up this point that, so Minnie's talking about Parkinson's disease, idiopathic Parkinson's disease, which is, heard of Michael J. Fox, which he's had this for how many years? Like since he was 28 years old. And yeah, it's like, that's unusual, but he gets probably the best care in the world. And he's had brain stimulators put in, he's taking, but anyway, point being this, idiopathic Parkinson's disease is what you all think about with somebody who has a tremor, stooping over. I think if you go to Costco or Walmart, you will see somebody walking in and out with a stoop posture with a tremor. That's probably Parkinson's disease, but it could be a stroke-related condition that caused the dopamine centers in the brain to not work anymore, and that the patient has Parkinsonism. So the disease, as you all think of it, is Parkinson's disease, but MS can cause Parkinsonism. You can have, if you damage the brain from a traumatic brain injury, from a stroke, from some people maybe alcoholism, anything within the brain tissue that affects the dopamine centers can cause Parkinsonism. But the condition you all know about, which is degeneration, gradually loss of this neurotransmitter that when it's not present makes you slow down. Voice gets softer often. You may get a tremor. Not everybody has a resting tremor in their hand or their foot, or they may start having difficulty sitting up from a lying position. A sitting position, have to rock themselves up. That's the classic patient. Gradually usually over years, but you can get this suddenly. There's diseases. If you have a head injury, a month or two later after you recover, you could start having a tremor. And if you damage the brain enough in a specific part where dopamine's being affected, you can get Parkinsonism. So I think of Parkinsonism also in the same way of dementia. It's a spectrum. But Parkinson's disease to the community is what you all would know. But when I think of it as a neurologist, we think about other things that can cause problems with slowing down, stooping, shuffling, sometimes tremor. Not everybody has a tremor, so I hope that makes sense.
Oh, that's super helpful. Thank you. So, Nikki, misconceptions in our community that we need to do better education and awareness about that you see from your role?
Yeah, I'm sure we have all heard of the myths that some of the causes of Alzheimer's or dementia include aluminum in our cooking pots, mercury in our fillings, flu shots. None of those things cause Alzheimer's or dementia. There has been a great deal of research. Yes, you can all breathe a sigh of relief, right? Especially for those of us who grew up in the UK and had a lot of fillings. So, yeah, that's a relief for me. But those things do not cause Alzheimer's or dementia. We don't need to worry about those. In fact, flu shots have been shown to keep us healthier for longer, right? So also one of the other misconceptions is that there's nothing that we can do to prevent or delay the onset of cognitive decline. And there's a lot of research around that we're hearing much more about at this time. And I think we're going to talk about that, but that's very important to know as well.
Can you share some statistics in terms of the impact within the community in terms of Alzheimer's?
Yes, I'd be happy to. Just this week, the Alzheimer's Association released our Facts and Figures report. And the report lets us know that in Nevada, in our state, there are about 54,900 people who are living with Alzheimer's over the age of 65. We know that your risk of developing Alzheimer's disease increases as you age. So those who are 65 to 75, there are fewer. But those who are over 80 and into their 90s, there are probably more. So that's about 10%. That's about 1 in 10 over the age of 65 who's living with Alzheimer's. We also know that the burden is huge for caregivers. So there are about 84,000 caregivers in our state who are providing unpaid care, typically about 30 hours a week. So if you're caring for a loved one, you're also raising grandchildren, caring for grandchildren, maybe still working, having other hobbies, then that can be very demanding and very stressful.
So I think we're going to talk about some support services and, yeah, perfect. So maybe, John, I could ask you, for those of us who are aging, just a few of us, most of us are going to have to stay the way we are we going to lose our cognitive, reasoning, thinking abilities as we continue to age? And is there anything we can do to slow it down, prevent it?
This is an hour conversation, so I'll start off and do this.
Got 6 minutes.
Okay, timing. So first off, there is normal aging, and this is very difficult to know in anyone. Sometimes I'll see a patient, and the reason is, doctor, I have this complaint. I'm forgetting things. I'm dropping things. I'm going into a room, and I can't find what I went to get. This is very common, actually, in their 50s to forget keys, personal items. It's kind of how often is it happening? Is it becoming frequent? Is it progressing? There are certain things that happen to a normal brain when you get older. Everybody loses brain tissue. Everybody in this room is losing brain tissue, and we'll talk about what you can do about it. But they've done MRI studies on patients by decades, from 50, 60, 70, 80, 90, and people lose about 1% of brain tissue a year, and that's hundreds of millions of nerve cells when you have billions. I feel like Carl Sagan, but it's true. It's true. So the point is that, yes, everybody's losing nerve cells, but on the other hand, you'll know people that are in their 90s, and I see a few of them. Most of the people I see have issues because that's why they're seeing me, but I've definitely, you all met people in their 90s that are super agers that have pristine memory and thinking that are 95 to 100, but that is very, very rare, super rare. and I would say it's way under 1%. I'd say it's like 0.1%. So when you get older, you lose your tissue. You will lose tissue just like you lose muscle mass. Just like people get short, you lose bone tissue in your spine. That's why people start to shrink. There are people that don't do that, but every part of your brain, you lose muscle, you lose bone tissue. Your teeth will lose their enamel. Your gums typically will recede. Your brain does lose. Call it atrophy. So anybody in this room who gets an MRI for whatever reason over the age of 70, I will suspect with a very high degree of certainty the neuroradiologist will say this so-and-so has atrophy. Atrophy means brain loss, but it doesn't mean you have a disease. So it's important to know that. We go by symptoms. Neurologists, we ask questions. How is this affecting you? It does matter what your brain tissue looks like, but it's how you're functioning. Functional status. That's the most important thing. What can you do about it? Yes, you can do lots. There's something called cognitive reserve. You may have heard of this term before. There's a gentleman named Jakob Stern at Columbia University. He's a PhD that about 10 to 15 years ago coined this term because it's very important, stating that when people get older, not to any specific age, because I don't want to be an ageist, but I would just say, I'll use the word 50 or more, that you will lose tissue, but you can maintain functioning by doing certain things. And those things are usually lifestyle factors or reducing risk of things you're doing bad, such as drinking alcohol. We can talk about alcohol because my belief is it really is not beneficial to you at all, with a slight benefit to your heart, and that's even debatable. So alcohol is an issue. Exercise clearly has been shown to increase and maintain brain mass, including your hippocampus, which is where your memory centers are located, in the middle part of your temporal lobes, which is right kind of under your jaw and deep. You can't feel this, and don't try to stick your finger in your nose and find it because that will cause, don't do that. So, brain damage. We don't want that. I have enough patients. We don't want that happening to. So, but the point is, so exercise, definitely nutrition, plant-based diet. We'll talk more about that. Low sugar content. Diabetics are extremely at high risk. We're not clear exactly why that happens, but type 2 diabetics have a higher risk for cognitive impairment. So maintaining your, a sugar level that's adequate and removing processed sugar has clearly been shown, absolutely, both in rats, primates, and humans, to reduce the risk of cognitive decline. So yes, we lose brain tissue. Yes, you will slow down your mind a little bit because everybody does get a little bit slower and you may have difficulty multitasking a little bit. That's actually considered normal for most 50-year-olds. Yes, there are people that don't do that. But look at your lifestyle. This is what we're going to talk about later. There are many things, and it really comes down to the basics, just like heart disease. Do you exercise? How often do you exercise? What are you eating? How are you sleeping? Do you have any issues with mood, like anxiety and depression? And sometimes medications can cause cognitive problems. But again, you have a lot of modifiable risk factors that you can deal with, and each person has their own. Rarely do I see one person they have no problems and they're losing their memory. So a lot of these things, yes, you have a genetic some people have predispositions to losing their thinking and memory, and some people may not get demented, but these decay rates can be, when you're getting older and noticing changes, you theoretically, I won't say theoretically, based on research, by looking at your lifestyle and looking at the common factors. And again, this is the same thing for heart disease. If anybody's had an angina, has a stent put in, your cardiologist should say the same things to you because you want to maintain your blood supply. The vascular supply to your brain is absolutely important. I would say that's kind of the most important thing I would say is anything that has to do with cholesterol, sugar, anything that's going to build cholesterol in your vessels is not going to be helpful to cognition when you get older. And those are all modifiable. Whether you're using atorvastatin, cholesterol medicines, sometimes you need that, right? Sometimes you do. But a lot of times you can do plant-based diets. There's another book I will mention later. I forgot to put in here, but I think you all need to know about it.
We'll definitely
that was about 8 minutes or 10.
Yeah.
Sorry, I had to go over.
No, you're good. We covered a lot. We need to break that down a little bit. So, Nikki, if you could pick one, what is one thing we could change or modify to help us in terms of brain function over time?
I heard Dr. Arts tell us this a couple of years ago, and it's something that I always suggest to people is managing your stress, managing your anxiety, the things that challenging demands on your time, your mind. Get those kinds of things under control. That's one thing that's super important. And then sleep, we talked about, nutrition. And you are all doing a great thing by being here today. You're learning something new. You're stretching your brain. You're challenging your mind. So staying in school, taking classes, doing new things are all things that you can do to contribute to better brain health.
Wonderful. I really had my mind stretched earlier this week talking to these three and trying to keep up.
Can I add something to this? We're going to probably talk about this, but it's important because it needs to be repeated. So there's this thing called neuroplasticity, and you may have heard of that. It's kind of it's not even a new term. It's been used for over a decade, but all the research when it talks about cognition and memory and retention and improving your memory, improving your thinking, you can actually build brain cells when you get older, even in your 90s. Like 15 years ago, that wasn't clear that could happen, but it definitely can. So exercise increases what's called brain-derived neurotrophic factor. And yes, pharmaceutical companies would love to develop a pill. Yes, just like they would. So no exercise, but exercise increases it dramatically, and it actually sprouts new nerve cells in your brain, especially in the memory centers, which is the hippocampus. So that's why exercise, including for Parkinson's, it's one of the actual modifiable risk factors. Mindy can definitely talk about that. Exercise is so important to maintaining brain function because you can modify the nerve cells. You can create new ones, but you can actually, we call it the use and disuse theory. Just like if you exercise, if you, for example, play golf, play tennis, the more you play, the more it becomes automatic, and you may not have to think about your swing anymore. When you go out to play this, new people that are beginners often will hit balls all over the place, and eventually, if you play enough, your brain has been adaptive. So the muscle cells in the cerebellum, which is back here, that's your movement center, have adapted and actually connected in a specific pattern. So you're not having to think about it as often when you're doing those type of activities. You can be playing a musical instrument, for example. So use and disuse, that's important. You want to do something over and over again. And I think Brett or somebody had just mentioned cognitive stimulation, super important. Whether it's reading, puzzles, I think you've read in the late literature, the New England Journal in the late 90s said that crossword puzzles were great. Yes, they are, because it stimulates your language centers. That's only one part of the brain. There's many other tools that you can use, and some of them are, we can talk about this later, technology tools. Maybe you've heard of Lumosity. And again, I am not getting paid to say what I'm saying by nobody. Like, none of the books, I get nothing. So this is all truth. We're here for the truth.
And we can't afford you, Johnson.
Well, I didn't get paid there either. So nothing. I'm not sponsored by anybody except myself and what I know. So the point is that Lumosity and Posit Science, there is data, and there are tools you could use on the internet that do, in theory, stimulate different parts of your brain that could enhance the connectivity. So a lot you can do. Don't give up, even in your 90s.
Thank you.
Sorry.
Yeah, you're great. It's great information. Mindy, when we were talking, we talked about aging and we're changing, but you said that's not necessarily a bad thing, that's a good thing. Can you just elaborate a little bit more on that? How we need to embrace whatever change has taken place?
Absolutely. It kind of goes along with all that we've been saying about reducing stress, accepting where you are, and making the most of it, and living the best life that you can with your abilities that you have. Exercise is amazing because it is a stress reducer. It helps with strength, balance. It helps with increasing that dopamine, the happy pill, right? You get your dopamine high. Maybe you're not running a marathon, but you can get a dopamine high. And it helps increase that blood perfusion through the brain, as we're talking about blood flow. So exercise does all of that, and it helps with that increased blood flow, and especially if you do something somewhat intellectual while exercising. There are exercise programs specifically for Parkinson's, I know, where they have you having to say certain things or count in a certain way while you're exercising. That's working your voice, that's working your mind as you're thinking. You have to think maybe you're punching a bag 1, 2, 3, 3, 2, 1. How are you doing it? So you're using your brain, and that's improving that neuroplasticity that we're talking about. So it helps maintain what you have as long as possible, enjoy what you have as long as possible, and maybe even readapt. You know, you always hear of people who have a nerve injury in their leg, and it takes a while, but it can grow back. There are ways to improve that circuitry in the brain, as Dr. Arts was talking about, where you can improve your function too. So it's not, oh, this is the beginning and the end, I'm done, I'm going to go lie down and die, right? This is, yeah, there's some changes, I can deal with it. I'm going to increase my exercise, I'm going to increase the blood flow, I'm going to improve my balance, I'm going to improve my thinking.
So that's all fantastic advice, but I can see a couple of people here in the audience, no names, maybe I'm included. It's like, it sounds good, but I don't really want to get started. It sounds like hard work, changing my diet, exercising. So just any advice, like how to create that new habit that we know is super beneficial for us, but sometimes we just have trouble getting started?
I would say have a group. Have your peer group, go to a exercise class with people with either a similar problem as you have, maybe similar age or not similar age. Just get inspired by people around you. Have a conversation in your home. Gee, this is a healthy diet for all of us. How can we make it fun? Let's eat the rainbow. Let's make it really colorful and crunchy and tasty and interesting so that we all enjoy the meal and we all do it together, because then you're not going to feel like, oh, I'm the one who has to avoid sugar and they're going to go eat the chocolate cake, right? We all do it together and enjoy it together.
Awesome, thank you. So I saw some people rolling their eyes when the topic of alcohol came up. So, John, can we just talk about alcohol? I thought red wine was good for me. I've been drinking red wine because I thought it helped my heart. The Italians all seem healthy and they drink lots of wine, so you seem to be contradicting that. Popping my bubble?
Yeah, no, I'm not popping it. I was in the Bay Area for almost 20 years, and I was saying the same thing, and I had patients from Napa and Sonoma, and I did not get in trouble. So I didn't have anybody from Vineyards comments like, John, you got to stop saying that. I wasn't very far from Napa and Sonoma. But anyway, the reality is yes. A cardiologist will tell you that red wine, because it has resveratrol in it. Has anyone heard of resveratrol? So a gentleman at Mass General Hospital, David Sinclair, he's been on 60 Minutes. He's on YouTube. He promotes, some of this, you have to be careful about what you read on YouTube or see on YouTube and hear on YouTube. But David Sinclair is a reputable person, and his lab discovered resveratrol, which is an antioxidant, and it's found in the covering of the red grape. It's not in the white grape. And I'm not sure which specific, what the concentration is. And yes, you can go on Amazon and try to buy resveratrol capsules. Some of them are expensive, but that molecule has suggested to reduce risk for cardiovascular disease. But in the brain health literature, there really isn't a lot of available data that wine in general does anything for here, except accumulatively can cause damage to the brain tissue. We don't have any equations right now to use, like I drink 3 glasses, 6 ounces, we can multiply it with this and say what your 5-year risk is, your 10-year risk is. We don't have that data. I think of it in another way. What is alcohol? What is it doing? Yes, some people like to drink it. Some people like the taste of it. Some people are doing it. Oftentimes, if you ask psychologists and psychiatrists with their patients, they'll say because they're treating an underlying problem, because it makes them feel better. So they're treating their mood issue, making them feel better, which in a way is a maladaptive approach to their problem. But on the other hand, from a brain health standpoint, there is not much data. And there's a book, I'm just going to say it right now. So this book by Maggie Moon, you may have heard of the Mind Diet, because it's one of the diets besides the Mediterranean diet. It was published in 2017. I actually started with a woman in Cleveland, Ohio, a podcast I don't get paid for it. Just to get the word out. And we actually interviewed Maggie Moon about 6 weeks ago. She's in Los Angeles. She wrote the book. She's a dietitian, and she's actually updating her book, and it's going to come out sometime in 24. And she's actually taking red wine. If you look, if anybody's bought the Mind Diet book, there's a glass of red wine on the front. She's actually done more research, and she told me she's removing the glass of red wine from the book because it was giving people the wrong impression that amount of wine was helpful for the brain. So you can ask cardiologists, we can have a debate. It would be a great debate between cardiology and neurology and have a wine little competition here about how is it pros and cons. But in my opinion, from what I've read, I don't think it's helpful. It does increase the amount of calories depending on how much you're drinking. If you multiply that out over a year and you're drinking 5 days a week, you could gain 5 or 10 pounds of weight just from that intake. And that's true for beer too.
Wow, that's a lot of extra weight.
Yeah.
Waste.
Easily. That's why when you go on cruise ships, be careful about how much you're drinking.
So the book John was referring to is on the second page of your handout. There's a section there, recommended reading list, and it's the 6th bullet point. So if you want to circle that one and take a look at that book. So we have all of John's recommended books on the handout, and they're up on the slide. So one we didn't touch on is sleep. When the three of us were talking earlier this week, sleep came up a number of times. Nikki, did you want to talk to sleep?
I'm going to defer to Dr. Arts and Dr. Lockshin. I think they know much more about that than I do.
Mindy, do you want to talk about sleep?
Sure. Sleep is something we all occasionally struggle with, and some people struggle with much more than others. Sleep disturbances are actually sometimes the very first symptom of Parkinson's that is recognized, at least. You might know of Alan Alda, the actor. His first symptom for his Parkinson's disease was what was called REM sleep disorder, which means REM is the rapid eye movement. It's your dream state. It's something that is very difficult for couples if one person has REM sleep disorder because they might act out their dreams and punch their neighbor, kick, vocalize, wake up their bed partner, and that can be very disturbing. It also can lead to a lack of sense of feeling rested during the day, and lack of being rested, as anyone probably here knows, makes all your other symptoms feel worse when you're tired. I mean, if you're really tired and stressed and you sprain your ankle, that ankle hurts way worse than if you were doing it dancing at somebody's wedding, right? Sleep is important for being able to deal with the day-to-day issues, and sleep can be a sign of some neurologic disorders. Parkinson's also known to cause people to have a lot of poor sleep. I can tell you my father has Parkinson's, and he wakes up routinely at 3 in the morning and just can't go back to sleep, and that's it for the day. So there's a lot of other symptoms associated.
So what do we do if we're having poor sleep? We don't seem to have any other issues at the moment.
Exercise.
So this is another hour conversation, but I'm going to say this. This is important.
You've got 60 seconds.
I can't do that. Okay, I have to leave. So melatonin. Everybody hears of melatonin. It's the number one. Everybody that comes in to see me is on melatonin. It's probably safe. 10 milligrams or more is probably not helping you. The most common side effect actually is headache, actually, for melatonin, or being groggy the next day, even though it's actually being theoretically used to maintain sleep. Most people, if you're going to try this, assuming that you don't have sleep apnea, which is probably the number one cause of poor interrupted sleep, is it somebody who snores over the age of 50. And by the way, you should be checked for it. I think that's like hypertension is one of the silent killers. I think sleep apnea indirectly is also one of those top things that often is going undiagnosed. So anybody who snores out there that has poor sleep, that feels that they're not rested in the morning, you should ask your primary care doctor, do I have sleep apnea? We have little tools we can use. We can do a home oxygen test. You may have had. Some people may have sleep apnea and are on CPAP machines. It can be treated. Some people don't like the tube, but unfortunately, that's the most common way to treat that condition. So melatonin, 3 to 10 milligrams, that's okay. There are other medicines that we can use, but I try to stay away from things because oftentimes it may be anxiety, or you may be drinking too much caffeine, or you may be drinking too much alcohol. Alcohol is a diuretic. It can make you urinate. So anybody that's waking up more than 2 times a night, and they're drinking alcohol probably from 3 o'clock onward, I would stop it. I bet you potentially your urination will be reduced, or drinking too much water before you go to bed. You fill up your bladder, and it wants to release it, and so that's another common cause. But the third cause of peeing too much is actually sleep apnea. Look it up. Yes, there are people that are treated for sleep apnea, and they're peeing 4 or more times a night, and it goes down to 1 within 1 week of starting a CPAP machine. So the other thing is stay away from PM drugs, Tylenol PM. Anything that has PM, which is Benadryl, is bad for your brain because it actually blocks the same chemical called acetylcholine that affects memory. Now, it's okay to take for a few days, but you don't want to do it continuously. I know people that are taking a lot of Benadryl, which essentially is the bad culprit. That's not good for your thinking and memory, because the way it works on your brain is it blocks the chemical that's important in memory called acetylcholine. And finally, about sleep, I'll say one last thing, that yes, there are people that sleep 4 to 6 hours, and there are a few people that feel refreshed, but the average sleep time should be 7 to 9 hours. Now, if you have a disease of the brain, and Mindy, from her support groups, I can tell you people with Parkinson's sometimes can sleep 10 to 14 hours a day, and that's not normal. But again, in your mind, you should be trying to reach the 7 to 9 hour range, and that's considered generally by the World Health Organization, the CDC, Centers for Disease Control, the range that most adult humans should be kind of trying to get into that range.
Thank you. Very helpful information. So maybe we talk a little bit about why it's so important to get diagnosed if something is going on. So John, you mentioned going to primary care if it's like sleep, but as far as other things going on, why is it important to get diagnosed as soon as possible rather than sticking our head in the sand? Maybe I could start with you, Nikki.
Yeah, sure. We encourage people who come and speak with us to contact their healthcare provider as their next step, to have that important discussion as part of the Medicare annual wellness visit, making sure that you're talking about memory. And then there are all kinds of services that are available, and there are opportunities to maybe enroll in clinical trials, to be eligible for clinical trials. There are new treatments emerging at this time for Alzheimer's disease, or for in its earliest stages, more in the pipeline. So being able to have access to those, if you qualify, if you have that conversation with your healthcare provider about eligibility. Also, you can start making plans. If you can make plans for your care, legal, financial plans, that brings the anxiety and the pressure and the fear down a little bit, and it lets you move on and live your life well. Spend time with grandchildren, travel, do all the things that you want to do without having to worry so much about what's going to happen next. And you can also access the services that we at the Alzheimer's Association provide, and many of our partners in the community, such as Dementia Friendly Nevada, support groups, education programs, care consultations, help with care planning, workshops, and all of those things. And knowledge is power, right? The more information we have, the better informed decisions we can make, and we can help people to move forward.
Thank you. And in your handout, a lot of the resources Nikki just mentioned are there on page 2. I think we have a slide. Mindy, what would you like to add?
Well, I know more about Parkinson's than I do about the Alzheimer's, but with Parkinson's disease, the couple big advantages to being diagnosed earlier. One is to recognize all the other support services, as Nikki said, that are available in the area and specific for the disease. Because Parkinson's there are some fabulous exercise programs specific for people with Parkinson's that really help with balance, with being able to make bigger movements, getting to a physical therapist who's a neurophysical therapist. Yes, there are subspecialties to everything. So a neurophysical therapist who really understands Parkinson's and the balance issues, the movement issues, and how to deal with tremor. Occupational therapists who will understand that tremor makes it sometimes hard to chop your dinner, things like that. There are tricks that they know so that, yeah, you have it, yeah, you're having to deal with it, but Parkinson's doesn't change how long you live, it just changes how you live. So the more help you can get early the better you can live that life. So physical therapy, occupational therapy, speech therapy are all really important. And the earlier they're started, the longer you will do well.
John, you look like you have something you'd like to add.
Absolutely. This is
I'm not surprised.
No. So
up on the screen too, I have your podcast. If you want to mention that somewhere.
Well, again, I don't get paid for this. This is totally my 25 years in neurology, working with Crystal, who's a doctor of behavioral health. We'll talk about that later. Which she started that last year, and we ought to interview Maggie Moon, who's the mind guy. So that's how I knew some inside information about that. But anyways, so it's important to know if you have a cognitive memory problem, because oftentimes it could be a manifestation, not of Alzheimer's disease, but something else. For example, maybe you are drinking too much alcohol and you think it's not enough. I've had people that go, I drink a little alcohol. I said, how much? Half a pint or half a bottle a day. And I'm like, okay. It's all relative, right? In Napa, that may be a very little amount, right? So I don't want to drag on the Napa people, but anyways, the point is that's all relative. Your belief systems are relative to yourself. And that's, and sometimes those belief systems aren't correct. But also high blood pressure, sleep problems. When you go to see a primary care physician, most of them know, hopefully. One of my goals in the UNR School of Medicine is teaching the second, third, and fourth year students that cognitive impairment memory problems is not just a manifestation of Alzheimer's disease, possibly early on, but there are many other things that can contribute to it, like medications. You could be on a medication. Don't want to scare people. You should talk to your pharmacist, because some drugs can cause cognitive impairment. So there's a number of things that if you have that issue, you go to your primary care provider and say, I have a concern. They should ask you, they don't have a lot of time, but they hopefully will address that and then look at the key things. So again, I think of it as the flag. Cognition, memory, it could be caused by so many other conditions, but in most people's mind, the worry always is, do I have the Alzheimer's condition? Just because it's been in the news and everybody knows about that. But I think when I'm thinking about a patient, I'm looking at different categories, depending on what their symptoms are. So it's getting it diagnosed early. You can actually reverse some of these patients. Some people have reversible cognitive impairment. I've seen people, it's not that common, but yes, there are people for 6 months or longer had memory thinking problems, and they were doing something in their lifestyle they weren't aware of, and it was improving. And it could have been sleep, actually. A lot of times it's sleep disorders. And then they correct it. You may have to have a sleep study. Oftentimes it's sleep apnea. If you're treating it and they start noticing, they're more attentive, they're more alert, they can hold information better, they're able to remember things for longer periods of time. So there are some reversible things. It's not like the end, I have a memory problem and it's going to go downhill from here. That is not always the case. And I would say at least 30% of the times it's not the case.
Thank you.
Yeah.
I'm just looking at the clock here, so we're kind of running out of time. So I just have 4 things before we go to audience question and answers. One, I want to thank you, Nikki, because you introduced me to Mindy and John. They wouldn't be here if it wasn't for you. So thank you so much to Nikki for making this happen today. Much appreciated. 2, all the resources, or a lot of them we've talked about, are in your handout on page 2. So that's a great resource to go to, and the books that John has provided us with. There's just way too much for us to be able to cover today. And then I have 2 final questions that I want to ask. One of Mindy and John. Mindy, the question I want to ask you about is durable power of attorney. That came up when we were talking. Why is that so important? Why should everybody have one here, even if you're 110% fit and going to live forever? Why should we all still have one?
Well, it kind of goes back to what Nikki was saying also. When you come to your primary care physician, I'm a family physician, no longer practicing, sorry, to come prepared with questions, to come prepared with your family member who you are perhaps living with. I mean, everybody has a different family situation, so that you can have some of these hard conversations early. So whether that be talking about what kind of things you would like done for end-of-life care. Would that be a living will that you'd like? A durable power of medical decision-making is assigning somebody close to you, could be your spouse, could be your child, could be a very good friend, to say, if I am incapacitated, I'm telling you what I want, and I want you to act on my behalf. And it is a legal document. And these are difficult conversations to have. When I was in medical school back in the dark ages, living wills were just starting to be recognized by different states, and they were starting to be acknowledged, and durable power of medical decision-making was there too. And we were encouraged to say, it doesn't matter if you're 20 years old, if you're 30 years old, if you're 70 years old. These are important conversations to have at your annual visit, because you never know when you could be in a car accident. I'm not wishing that on anybody, but you never know when some devastating medical condition may occur. And the sooner you have these conversations, when you are thinking clearly, when you are calm, when you have your get-together, whether that's, do you want to do it at Thanksgiving? Do you want to do it at some other family get-together, the summer barbecue? Maybe start having those conversations, because it makes you have control over what will happen to you and your body in the future. And it gives incredible relief to your family and friends to say, I know this is what they wanted. And that is incredibly valuable to the friends, the family, and to the healthcare providers to say, yeah, I see everybody's on the same page. They know you wanted this, and that's what we'll do. So it's just a very important conversation to have, and often is worthwhile meeting with an attorney, an elder law attorney, to actually get the documents as clear as possible, but at least having those conversations is important.
Thank you so much. John, the question I wanted to ask you, actually, before I ask you the question, let me go back to the handout. Can everyone look at page 2 of their handout? And I think at the very top it says, the one action I'm going to take because of today's seminar is, just to give that some thought over the next 10 minutes. Is there something that you've heard today? Maybe it's exercise, changing your diet, drinking less alcohol, going and seeing your primary care physician. But what's one action that you know you should take? So just think about that as we talk with John. What I wanted to ask you, John, from our conversation the other day is, in publications recently, and maybe over the last 6-9 months, there's a new drug that's come out to help us with Alzheimer's. I just wanted to get your take on it, because you're a neurologist, you see lots of patients. Just thoughts that you might have, because I know that's probably going to come up in Q&A.
Yeah. So this medicine called Leqembi came out by Biogen Eisai Pharmaceuticals on July 6th. It was FDA approved. And what it is, it's an intravenous medication. It's given twice a month, IV. There was a drug that came out in 2021. You may have heard about it, called Aduhelm, a Biogen drug. It's actually being removed from the market because, number one, it probably shouldn't have been approved. There was this big to-do, the FDA advisory committee. There were 3 members, senior neurologists at very well-known organizations, including Mayo Clinic, and I believe at Harvard Medical School, that said this drug shouldn't have been approved. It was approved anyway, and now they're really kind of making it go away slowly because nobody was using it, because what happened is a lot of people have brain bleeding and brain swelling on the drug. We call it ARIA, which essentially in medical terms means if you get an MRI, sometimes you'll see brain bleeding episodes. Sometimes they're big enough they could kill you. Small group of people died in the study, or brain swelling, cerebral edema. And so the point is, this new drug came out in July. It was very similar to the prior drug called Aduhelm. It met endpoints slightly, which meant that they were looking over time. It was an 18-month study, so 1.5 years, and they said, did this drug slow the condition down? Did it do anything for patients that were exposed to it? So the benefit was about a 5-month slowing of the condition. That's what most people are saying on the internet. That includes researchers at the big prestigious universities. The problem with this is that 10 to 20% of people in the study, there were only 529 because I think 140 dropped out of the study because they couldn't tolerate the drug. The ones that were left over, 10 to 20% had hemorrhage or cerebral edema. I've been talking to every patient or family member since June. Even before the drug came out, I had nobody on the drug, not one person. That's over 350 people at least that I've talked to, mainly because if you look at the risk-benefit analysis, which means that the risk of the drug, taking at least a 6-month risk of being exposed to the drug and having something potentially catastrophic, which can't be predicted, and not being able, I can't predict it, you wouldn't be able to predict it, And if it's bad enough, there's nothing we can do from a medical standpoint except support you, and you could end up being like in a very bad situation, including dying. The benefit of 5 months, looking at the overall time period of a patient with Alzheimer's, which is usually many years, the absolute risk is very small given the absolute benefit is relatively it's small compared to the risks that you're taking. So I've only had one patient since June that was considering seriously the drug. So I'm not thinking you're losing out on anything because I talk to everybody, I give them hands out, give them information about what I feel, what other people feel. And there's another drug you're going to hear about called denalimab that's probably going to come out very shortly. It's a once a month instead of every other month. Twice. It's going to be a once a month IV drug, but it actually has a higher risk of brain swelling, up to 30% Almost 1 out of 3. I don't be negative about this because I know. I'm just saying from my perspective, the benefit is an extra month. So you potentially could get an extra month of a slight slowing down. It doesn't reverse anything. The way it works is amyloid, which is a protein in the brain that gets deposited, and there's a great debate about how much amyloid really contributes to the Alzheimer's condition. We definitely know that most patients who have the Alzheimer's disease of the brain have this protein called amyloid, but there's a lot of patients that don't get benefit. And so there's been many studies with these anti-amyloid drugs over the last 15 years, and this drug, those two drugs, At-Home 2021, the drug that just came out in July, Leqembi, and then another drug, denalimab, are specifically looking at this, trying to remove the amyloid so it doesn't get built up in your brain because in theory that's what's damaging the brain. But we know a lot of people have other risk factors like heart disease, cerebrovascular disease, that is playing a significant role in the decline of their thinking, even if they have the amyloid protein built in the brain. So it's not a clear... So I wouldn't worry right now, put it that way. I got to go see Dr. Arts because I need to be on that drug. That's not... No, don't do that. Don't do that. I'm telling you, if I had 100 people and I'd be telling you I have nobody, 0. I tell them the literature, I explain the risk-benefit profile, and that's how it is right now. They're doing extension studies, which means phase 4 studies. We'll probably find out by the end of this year, 2025, more people exposed to the Leqembi drug, which is the drug that's every other week for Alzheimer's. It's indicated for early to mild stages of Alzheimer's disease. We'll know, is it truly effective? Is it more than 5 months? Right now, that was what the study, it was called Clarity AD. That was the study that Leqembi was approved upon, the data. And maybe we'll find out. Maybe there's more risk than we know, but we just don't. So again, I think the most important thing is if you do have early stage Alzheimer's, there are things you can do. And read the book Aging with Grace. Did you read the book Aging with Grace? 1995, Chris Snowden, PhD. I didn't write that because there's too many books. He actually looked at Alzheimer's patients in nuns in the Midwest, and 20% of the nuns who had Alzheimer's, severe amyloid in the brain, had no cognitive problems when they died. So we know that there are people out there that have fluoride amyloid, the protein built in their brains, and by based on neuropathology, if you asked a pathologist, does that patient have Alzheimer's? Yes. That person's brain has the changes. They have amyloid, they have tau. Those are the two proteins. But in that study, and that was in 1995, 1/5 of those patients had no cognitive problems. They all had to be autopsied. That was part of the study. So it tells us it's amyloid, yes. We know that there is a component to the cognitive deterioration in Alzheimer's, but there's also a component of cerebrovascular risk factors. And those are the diabetes, the lack of exercise, the sedentary lifestyle. Anything that affects blood vessels to the brain, that's what you can modify. That's what you can modify. And so that's why there's hope with this. And there's clear data that show that people that have Alzheimer's disease, if you modify the risk factors, do you check your blood pressure, right? A lot of people have hypertension. They don't check their blood pressure. People that have poorly controlled high blood pressure, their cognition, their memory, their thinking tend to go down much faster. Actually, whether they have Alzheimer's disease or not, but especially if you have Alzheimer's disease, because it's a multifactorial process. That's kind of where we are right now.
Thank you so much. It's great information. And, thank you for sharing.
Yes.
And after I was talking on Tuesday, I went and ordered a blood pressure monitor for home for my wife.
And again, I have nothing I want to say. So, I don't get paid to say it's Omron, O-M-R-O-N. I think they're the Apple or whatever you want to say they're the Tesla of blood pressure cuffs. So you can get a Series 5 or 3. You know, it's kind of like, oh, cool, I have a Series 5 like a car. I have a Series 3, 5, 7, 9. Just get the Series 3. That's the $40 blood pressure cuff. They're like, they're reliable. Get a digital cuff on the arm. Don't use the wrist cuff. Ask your primary care doctor. They probably are going to say the same thing. Yes, there are a lot of companies that make wrist cuffs. These tend to be more reliable. The digital arm cuff, get an Omron. Again, there are other companies. Buy the cheap one. You don't need all the whistles on that thing. Get the $40 one.
Can someone on my team write down Omron Series 3? I have an Amazon return to send back because I obviously bought the wrong one.
So can I have my mic runners up here, Debbie and Vic? I'm going to give you my microphone, Debbie. Vic, as you come up, could you introduce who you are, organisation, and you're going to take my left side of the room.
Right. Hello everybody, my name is Vic Denegris and I'm with Amada Senior Care here in Reno. What we do is we provide non-medical assistance for seniors in our community who might need some extra help with daily activities, things like showering, toileting, meal prepping, transportation, light housekeeping, laundry, that type of stuff. Anything on the non-medical side. We also do long-term care insurance policy assessments for folks that might have those policies. If you have any questions on your policy and need some more insight into that, you can give me a call. I've got cards out here on the table. Come by, chat with me, and yeah, we can help you out with that as well.
Thank you, Vic. Debbie.
I'm Debbie Wood. I'm with Mason McDuffie Mortgage. I arrange all sorts of home loans, all kinds, including reverse mortgages.
Awesome. So if you have a question, please raise your hand and our mic runners will get to you. I see a hand. Run, Vic, run, way down the very back. And while Vic's running down, so what's your question?
First question of two is...
actually, just rules here. Just one question, just so everyone has an opportunity, so pick your best question. And please, just keep it to a question. I know everyone has comments, information they'd like to share, but can we please just keep it to questions, because we only have like 15 minutes. So yeah, please, go ahead.
I've heard that free radicals, which come from association with aluminum, are actually one of the causes of Alzheimer's and perhaps Parkinson's. Would you comment on that?
So,
and if we can keep our responses short, so we can get through as many questions.
So, I'm just going by what I know and what patients have told me over a long period of time. There are some, I don't want to say rumors, there are some associations or trends about certain environmental effects on the brain, and I think that out of all the things, including Alzheimer's and Parkinson's, I think the strongest one is the pesticide theory with the VA. I've seen people from the CRVA where they were exposed to Agent Orange or some type of organic products. But in terms of aluminum, I don't think that, from what I've read, and I do keep up with this, that there's data that, number one is we don't test for it. Doesn't mean that you know, I haven't seen outbreaks where I have been, where I was at Kaiser Permanente actually for a long time, and they're very strict about prevention. They have a big team, and to answer the question, there was never any studies when I was there for nearly 20 years where they were looking at that as being some, you know, high risk. You may have heard Kaiser did one of the studies with breast cancer many years ago. They did a lot of these prevention studies, and there's so, again, I believe there is some association in the literature, but it's not strict enough, and it's not something that I'm educating patients on, like staying away from something. People, well water is the same thing, right? People think that there's something in their well water. They have fungus exposure, and it's causing their brain problems. There's a lot of misinformation out there. There's associations, but no direct correlation that I know of with aluminum, at least for the brain condition that you're talking about.
Thank you.
Speaking of environmental effects on the brain, Dr. Art, do you or do you know a neurologist in town that has any experience with mold-induced, mycotoxin-induced neurotoxic encephalopathy?
No.
None?
None.
Not a one, huh?
None.
Any info on that?
No.
How unfortunate.
This side. So our three panelists are going to hang around. I asked them if they'd be willing to be here for a while. They will. So if we don't get to you and you have questions, they will be here for a little while afterwards. question number.
My question is related to Alzheimer's and type 3 diabetes, and if sugar plays a role in amyloid plaque buildup.
Yes. So what's a really interesting study, if you pull up from less than a year ago, they actually exposed rats, which, you know, rats are 99% of our DNA. I'm sorry, that's true. I won't go any more into that. But point is that they exposed rats that were actually made to have amyloid. So you can genetically make animals develop certain diseases, and they did that. And so they actually exposed the rats to different concentrations of sugar, and they actually, based on the concentration they were exposed to, developed actually increased the amount of amyloid deposited in the brain just from sugar. So it was like a dose response curve. So this whole issue about type 3 diabetes, if you read the literature, I'm not typically diagnosing, it's not actually a CPT code, which is what we use in medicine, to like give you, it's the way we get reimbursed. I hate to say that, that's how, you know, you may have diseases, but I don't see a type 3 diabetes. What I would say is if you're a type 2 diabetic, for example, and you're having cognitive memory problems, the literature does suggest that you're at increased risk to developing dementia and an increased risk to developing Alzheimer's. And so there's this hypothesis, which I don't even think it's a hypothesis, I think it's a reality, that people that have Alzheimer's have dysregulation of sugar in the brain. And that's one of the reasons that lowering your sugar and reducing processed sugar does actually make people oftentimes their thinking becomes better. It doesn't usually reverse anything, but it probably is delaying the progression of further amyloid being deposited in the brain tissue.
Thank you. Sorry, question down the back, and then this lady up the front. Oh, okay, you've got a big, thank you. The line, okay, perfect. I can't see who's got the microphone, but whoever has the microphone, please go ahead. Oh, there we are. Ask your question.
My granddaughter is 5 years old. She has a hard time winding down at night, so they give her melatonin, 5 to 20 milligrams. Is that safe?
So there's no data that over 10 does anything. And I don't think I've never heard that higher doses this actually can cause like heart attacks or stroke or kidney damage or anything like that, but it's excessive. I wouldn't say that it's dangerous, but it's probably not effective. And melatonin is mainly good for sleep maintenance insomnia rather than sleep onset. So if somebody's going to bed and they can't get to sleep, oftentimes you have to ask the person, are you thinking about the next day? Are you a worrier? And a lot of people say yes, or they just can't their mind keeps rotating, thinking about it. Usually that's where meditation actually is helpful. So drugs aren't that helpful in that situation. It's not really good to take sedatives like Valium at nighttime because that has its own issues if you get up in the middle of the night and you can fall over because you're kind of over-sedated. Or Klonopin or Xanax.
Thank you.
What is your take on Prevagen and Neuriva?
I was going to say, so they're great marketers. That's what I say. I actually watch the commercials, so I watch it closely. So if you look at the bottom of every commercial of Prevagen, Neuriva Plus, and Focus Factor, those are the big four, that they have to say this because there was not really a randomized controlled trial in medicine. We go by RCTs to say, yes, there was a group exposed to the drug or the product, nutraceutical, and a group that wasn't, and was there a significant benefit to the group comparing the control group and the group that was exposed? And they say that, and they have to say it on TV. There's been no, the FDA doesn't, it's never been really regulated, and it's never been shown to reverse, prevent, treat, or there's one other word they use, they have to say that. I have seen people that thought they were better, and there's a placebo effect for every drug. It doesn't matter what it is, even blood pressure. You can give a patient a blood pressure medicine, and whatever, your blood pressure can drop. There's a group of people where it will drop, even though it doesn't have any blood pressure component that should be actually affecting the blood vessels. So my answer is that there is a placebo effect. I don't think there's any danger to those things. But on the other hand, I don't think, from what I know, that any of those things are beneficial at all. But they are great marketers. That's what I will say on TV.
Oh, sorry. We'll get a microphone to you so everyone can hear. The lady behind you first.
My question has to do with the relationship of neuropathy to the brain and being on long-term medicines like Neurontin to treat the neuropathy. Is there hope for a cure, or what's the prognosis?
Yeah, so there aren't that many conditions. So if you're thinking about, so were you talking about Alzheimer's disease? Or like, I know neuropathy, what was the other part of it? There was neuropathy and GABA. So yeah, so gabapentin is a common drug that's now being used for chronic pain because the general consensus is that in most situations narcotics aren't beneficial or they can lead to addiction. Yes, there are definitely patients that need those. Gabapentin, Neurontin, and Lyrica have become like the go-to drugs when essentially replacing narcotics. And gabapentin has its own side effects. GABA is a sedative, so essentially it slows the brain down. So essentially that's what it does. And unfortunately, there's some people that have to take a pain-reducing medicine, and then you have to deal with, it's kind of the rock in the hard place. How much of the drug is helping your symptoms, and if there's any other options available, versus how it's affecting the brain. Sometimes the only way to know is to try to taper off the drug and see how you do off of it, and some people can't do that because they're in so much pain. But about the neuropathy issue, a lot of times we don't know what causes neuropathy, peripheral neuropathy. The most common causes, diabetes or long-standing pre-diabetes. Some things you've heard of chemotherapy, but that's pretty obvious because you're getting chemotherapy and you get numbness and tingling in your feet. There's some conditions that you may have heard of called CIDP, which is an inflammatory condition that comes on over a long period of time. It's actually treated with steroids or IVIG. Oftentimes it can be hard to diagnose that. We have to do electrical testing to look how the nerves are conducting. It's called nerve conduction tests. But about 30% of peripheral neuropathies that are going on slowly over years, we don't know the cause. We call it idiopathic. Even the Mayo Clinic doesn't know that. You know, the big centers.
Thank you, John, for that short answer.
Sorry, I can't go short. I can't go short.
Where are we over on this side? And if we could keep questions, if you don't mind, general. If you have specific questions that are just specific to you, that probably don't help the rest of the audience, come and ask those one-on-one, and the panel's happy to answer.
I have read where there's a connection between hearing loss and higher risk of dementia. Can you address that?
Yeah, so I think that two things. Macular degeneration, by the way, has a high incidence of cognitive impairment. I think of macular degeneration actually as the Alzheimer's of the retina, because if you look at what causes macular degeneration, I'll get back to your question, is it's actually amyloid in the retina. It's the same protein that gets deposited with Alzheimer's. There's a lot of people who have macular degeneration and cognitive impairment. I would say there's a high likelihood they have both Alzheimer's and macular degeneration, probably from the same condition. And I'm not sure if we know about hearing loss, if it's from amyloid. But if you're not hearing well, obviously if people are talking to you, you can't get it to the part of the brain where it needs to go, especially verbal, I call it auditory memory, to be able to integrate what you're saying or what you're hearing and do something with that information. So I think there are a lot of people that do have hearing loss, and over time it's causing them to not retain information. And so if you're not learning information, it looks like you're becoming impaired. I don't know if that's answering the question completely, but I think a lot of people do need to have their hearing test. I think it's coming out more recently about the importance of hearing and its effect on the brain, which it wasn't 5 years ago. Yeah.
Lady down here.
Okay, that's interesting. Great minds think alike, because that was actually one of my questions about hearing loss. So thank you. But another question, melatonin. A couple of people claim to be retired doctors have said that older people, you shouldn't take older people don't release melatonin from the body as well as young people do. So older people shouldn't take too much melatonin or sleeping aid because it stores up in the body and it's bad for them. How is that?
So I've never heard of an accumulation of melatonin, like that in your liver or anything. From all of the, and a lot of people come to me, I would say 3 out of 4 are taking melatonin, because so many people have problems sleeping when they're older, and it could be, like I said, sleep apnea, and you're treating it with melatonin, and you may think it's getting better. I'm just saying that because it's untreated. But melatonin, over 10 milligrams, no benefit. And I have not heard of a toxicity or accumulation in your fat, because some drugs and some nutraceuticals can actually accumulate. I have not heard that, but I don't know everything. I'll be honest with you. I can't keep track of everything. I'll tell you if I just haven't heard
I don't think these people know everything either.
Oh no, I'm just saying, but I haven't heard that, and I have people come to me think they know everything. They do, right? Because my brother's a doctor, and we looked this up, and I'm like, okay, you may know more than I do.
Thank you. Over here.
Does heredity have anything to do with brain disease? And if so, is there any percentage assigned to it?
What was the first one?
Heredity. DNA.
Genetics.
I can answer a little bit of that. For Parkinson's disease, there are several genes that are associated with 10 to 15% of people who have Parkinson's, but there are a large number of people who have those same genes who don't have Parkinson's. And I think it's pretty much the same idea with Alzheimer's, that there are genes that are associated, but it's not a direct cause. It's not like Huntington's disease, where if you have that gene, you're going to have it.
So, you don't need to go to 23andMe and get ApoE4 tested. I've seen, I see people and understand why they're doing it. So ApoE4 is an allele. You get one from your mom, one from your dad, and there is an increased likelihood of Alzheimer's disease if you have ApoE4 and E4, and protective effect of your ApoE2 and 2. There's 2, 3s, and 4s, and you get one from mom and dad. So you can be what's called homozygous. That means if you have 2 2s, then you're homozygous for ApoE2. If you have one from mom and dad, or 4, you're homozygous. And so I had conversations with patients. They wanted to get it done, and now they're saying, and then so they get this feedback from whatever genetic company, I'm at increased risk. What do I tell them? Diet, exercise, talk, seriously. So even if you're ApoE4 homozygous, which is the highest risk, it does not guarantee at all that you're going to develop Alzheimer's disease. There are early onset forms of Alzheimer's, called early onset Alzheimer's, that are associated with 3 genes, APP, presenilin-1, presenilin-2. And I have not ordered that. When I was in the Kaiser system, we had neurogeneticists in Oakland, actually at San Francisco. We had 3 of them, and that was up until 2020. They weren't even recommending getting the test done. I don't think it's changed because you're not doing anything yet. Now, if these new drugs come out with these IV and they actually do show a prolonged improvement over years and there's low risk, and then there's going to be young people on it, then there would be probably a reason to consider at least the ApoE4 testing or something like that. But again, I don't recommend it.
And I would say that the only reason to get tested if you do the 23andMe is to participate in studies, because that way they can follow. And I know Michael J. Fox Foundation has a lot of excellent studies going on, and they just, yes, I've got LARC2, one of those genes, and they then just send a questionnaire. How are you thinking? And just once a year, or once quarterly, whatever they have for different studies, you just fill out survey questions and they start studying and learning more. But it's not a definite, you've got, you will get.
Thank you. We've just come up on 11:30, so out of respect to everybody, we're going to end it there. But if you have questions, feel free to come up to our panelists. Just a reminder, if you want to attend either of the upcoming events, please complete the yellow evaluation form, and we'd appreciate you to complete it anyway. Could you all give yourself a round of applause for being here, and especially also for our panelists?